guys, this week's topic is Parkinson's disease. It's a disorder of the nervous system. It is mainly a movement disorder. It is chronic and progressive. As for the causes or risk factors, firstly, it is seen in old age. Second thing is that it could be due to some genetic mutations like PINK1 or Parkin or alpha-synuclein genes, or it could be due to some medications like neuroleptics. But no matter what the risk factor is, ultimately the cause is that the substantia nigra in the brain, particularly the pars compacta of the substantia nigra, there the dopaminergic neurons undergo degeneration. So this produces the movement disorder. So coming to the pathology, just before degeneration in the neurons, you can see something called Lewy Bodies. These are round eosinophilic inclusions and they're made of alpha-synuclein proteins. So from the nigrostriatal pathway, the dopaminergic neurons send signals to the cerebral cortex, and from there movement is initiated, fine-tuned and calibrated. So as I've already said, when this dopaminergic neuron gets degenerated, the entire process of movement initiation, fine-tuning and calibration gets disrupted, and this is what brings about the movement disorder. So what are these movement disorders I'm talking about? There will be hypokinetic or bradykinetic or akinetic movements. Then there will be tremors. They are resting tremors. You have to remember resting tremors because this is what helps you to differentiate between cerebellar lesion and Parkinson's disease. Because in cerebellar lesion, it is when you try to initiate a movement, you get tremors. But in Parkinson's disease, it is resting tremor. And particularly it is pill rolling tremor because it looks like the patient is rolling a pill in between their fingers. And then there is rigidity. In this, the specific rigidity is cog wheel rigidity, where there is jerky movements. And then because of this rigidity, there is a stooped posture as well as a masked face. Finally, there will be shuffling gait because there is difficulty initiating the leg movements and there is postural instability. Now, substantia nigra obviously has other functions as well, not just motor functions. So these functions can also get affected, causing depression, dementia, sleep disturbance. And now let's talk about the treatment. First of all, there is nothing you can do to stop the degeneration. It will be progressively degenerating. But you can treat the symptoms. For that, the ideal situation would be to give dopamine. But dopamine cannot cross blood-brain barrier, so you have to give the precursor form, which is the levodopa. Levodopa can cross blood-brain barrier and get converted into dopamine and then make up for all the dopaminergic degeneration that has happened. So now levodopa, while it has to get converted to dopamine, it can get converted in the periphery and in the brain. We obviously want it to get converted in the brain. So the peripheral conversion has to be stopped. That is why levodopa is given with carbidopa. Now carbidopa is a peripheral dopa decarboxylase inhibitor. I repeat, it's a peripheral dopa decarboxylase inhibitor, which means that a lot of the peripheral levodopa will not get converted and it will be redirected to the brain. And that is what we want, more of the drug to reach the brain and not just get wasted in the periphery. Next drug is Amantadine, which will increase endogenous dopamine production. So basically it is making the body do the work of producing more dopamine. Apart from this, you can use COMT inhibitors like entacapone, you can use MAO-B inhibitors like selegiline, you can use dopamine agonists like bromocriptine. So basically at the end of the day, the goal is to provide more dopamine in any form so that the symptoms can be reduced. But remember, you cannot do anything to stop the degeneration. It is a chronically progressive disease. Now let's talk about the side effects of the drugs. So I mentioned that levodopa can get converted to dopamine in the periphery. So in the periphery, this converted dopamine can bring so many side effects like arrhythmia, dyskinesia or involuntary movements, nausea, vomiting and sometimes even hallucination. So to reduce the side effect, again we have to make sure in the periphery levodopa does not get converted to dopamine. So this will bring me back to the point which says carbidopa should be given with levodopa to decrease peripheral conversion of levodopa into dopamine and direct as much of the levodopa to the brain as possible. So this was a very quick and short summary of Parkinson's disease. If you have any feedback, please do write it down in the comments below, and we will see you next week with a new video.